Today I am going to talk about the disease Leishmaniasis. Leishmaniasis is an infection with Leishmania, a group of parasitic protozoa. Leishmania parasites are found in tropical and subtropical areas of the world. It can cause severe ulcers on your skin or infection of your internal organs that can be fatal. Antiparasitic medications treat leishmaniasis. What is leishmaniasis? Leishmaniasis is a group of illness caused by many types of leishmania parasites. You get it from sandfly bites. It can cause disfiguring skin ulcers and life-threatening illnesses. Leishmania parasites are protozoa, one-celled organisms that are too small to see without a microscope. The two most common kinds are cutaneous leishmania and visceral leishmania. Who does leishmaniasis affect? Leishmaniasis most often affect people living in rural areas of tropical regions or areas with inadequate sanitation. People with HIV and other conditions that weaken their immune system are more likely to get sick from a leishmania infection. Where is leishmaniasis most commonly found? Leishmania exists in over 90 countries around the world. Different types of leishmania are found. Experts use of term Old World leishmaniasis and New World leishmaniasis depending on where it's found. Old World leishmaniasis is found in Eastern Hemisphere including certain parts of Asia, parts of Africa including tropical regions and North Africa, Southern Europe, the Middle East. New World leishmaniasis is found in the Western Hemisphere including Central America, South America, some areas of Mexico. Types of leishmaniasis. Leishmaniasis falls into three main categories: cutaneous, mucosal and visceral. Cutaneous leishmaniasis. Cutaneous leishmaniasis is an infection in your skin where a sandfly bites you. It can cause bumps that turn into large ulcers over time. It can take a long time to heal on its own. Symptoms starts a few weeks or months after a sandfly bite. Very rarely you can have bumps or ulcers in many areas of your skin. This can come back again and again even with treatment. Mucosal or mucocutaneous leishmaniasis. Mucosal or mucocutaneous leishmaniasis is usually a complication of cutaneous leishmaniasis. Ulcers develop in your nose, mouth or throat. ML rarely gets better on its own and is usually fatal if left untreated. It can cause facial disfigurement. Visceral leishmaniasis. Visceral leishmaniasis, also called Kala-Azar, is a serious form of the disease caused by specific type of leishmania. It affects your internal organs like your spleen and liver. Symptoms sometimes take a few months or a year or more to develop after an infected fly bites you. VL can cause severe disease quickly. It is fatal if left untreated. Signs and symptoms. Symptoms of cutaneous leishmaniasis. Cutaneous leishmaniasis causes a bump on your skin where a sandfly bit you. It can have scabs or crust. Over time, it changes into an ulcer with a harder border and a sunken center. Symptoms of mucosal leishmaniasis. Mucosal leishmaniasis causes ulcers or sores in your nose, mouth or throat. You usually have one or more ulcer on your skin that appear at the same time or before those in your mucous membrane. Symptoms of visceral leishmaniasis. Visceral leishmaniasis symptoms include fever. This can start suddenly and come and go for several weeks. Chills, cold sweats, swollen lymph nodes, swollen abdomen from an enlarged spleen, weight loss, fatigue, weakness, dark and discolored patches of skin. Diagnosis and test. Tests your provider might perform to diagnose leishmaniasis include needle biopsy. A provider will use the needle to get a sample of tissue from your spleen, lymph node or bone and marrow. A lab technician will use a microscope to look for leishmania. This is the best way to diagnose visceral leishmaniasis. Skin biopsy. A provider will take a sample of tissue from an ulcer on your skin, nose or mouth. A lab technician will test the sample for leishmania. This can diagnose cutaneous or mucosal leishmaniasis. Blood test. Sometimes a provider might look for signs of Leishmania infection in your blood. They'll get a blood sample by inserting a small needle into a vein in your arm or by pricking your skin with a needle. Blood tests usually aren't very useful for diagnosing a current Leishmania infection since people can have it without symptoms. Sometimes your blood test can be positive even when you are not currently infected. If you want more information, please like, share and subscribe to my channel. Thank you.